Good morning or afternoon, everyone, and welcome to today's webinar, How the YMCA of Greater Vancouver used ePACT to enhance the camp experience. My name is Michelle, and I'm the Marketing Manager here at ePACT, and I'll be your host for today's session as well. So first, I'd just like to thank you all for joining us. Today's webinar is based on one of our customer success stories featuring the YMCA of Greater Vancouver, and we'll be exploring some of the challenges that the organization has experienced managing critical information for its members across multiple programs, and also how it's using ePACT today to better support families in a crisis. So moving on, so today's hosts or presenters, as I like to call us, I'd like to introduce my guest today. So Lisa Stiver is the General Manager for YMCA Sea to Sky, which is part of the YMCA of Greater Vancouver, and has been an ePACT customer since 2013. Lisa manages the operations of YMCA camps, 2 childcare centers, Gibson's YMCA Youth Center, and a variety of outreach programs on the Sunshine Coast here in British Columbia. She's also directed YMCA Camp Howdy, YMCA Camp Elphinstone, and has also managed a YMCA health and fitness facility. So welcome, and thank you so much for joining me today, Lisa.
No problem. Thanks for having me.
As I mentioned, and you can see me on the screen, I'm ePACT's Marketing Manager. My resume is not nearly as impressive as Lisa's, but I joined the team here in 2016, and I support every department throughout ePACT as a company in every aspect of marketing, from event management and social media to content creation and industry education. So much like this webinar, actually, which is a great segue into the rest of our session. So a little bit about both of our organizations. So the YMCA of Greater Vancouver, it consists of 4,000 volunteers and staff working together with more than 115,000 children, youth, and adults in British Columbia. So with camp, aquatic, childcare, and health and wellness programs across 185 locations, the YMCA is providing Vancouverites with a safe space to challenge themselves and reach their potential. A little bit about ePACT Network in case you're not familiar with us. ePACT is an online emergency network. We're free for families and individuals, and we provide them with a single emergency record to safely and securely store key health and emergency contact details in an online system. These records can be shared with organizations such as YMCAs and other recreation organizations that use the system to collect and manage information that's previously collected on paper, so things like medical information, waivers, and consents as well. So before we get started, the webinar is actually being recorded, so everyone today, attendees, and even those who may have attended and not made it onto the webinar today, will all get a copy of the recording so you can revisit everything and anything that you would like to afterwards. Audio for the session will be coming through your computer or your laptop speakers, I hope. If you do have any questions, comments, or even anything that you might like to share throughout the session, you can use the chat box in the bottom left corner of your screen, and we'll answer it as soon as possible. So we do have some time dedicated to Q&A at the end of the webinar today, and my fantastic coworker, Elora, is going to be handling a lot of your questions as they come in. So ask away. If there's anything that's on your mind, we would love to hear it. And as with any of our webinars, we really need and appreciate your feedback. You'll see a short survey at the end of this webinar. It'll only take a couple of moments to fill out, and your comments are extremely valuable to us. They allow us to continue bringing you relevant, useful content, and obviously we want to keep you joining us again in the future. So without further ado, let's get started on our content today. So by the end of today's session, just wanted to provide you with some key takeaways. So the camps and programs that your YMCAs provide to families are memorable, meaningful experiences. And there's no doubt that your staff do everything they can to ensure your members are safe while enjoying their activities, the programs, the camps that they're participating in. So with many YMCAs using paper forms to collect critical information, waivers, and consents, it's often a challenge to ensure that the right people have the right information at the right time. So by the end of today's session, we hope you'll have a little bit of food for thought about how you can create a better experience for families when it comes to collecting and managing critical information, how you can make sure that the right people have access to the right information while keeping that personal information secure online, and also how you can decrease administration for staff and program leaders by keeping information in a single central system. So, Lisa, you originally used ePACT with the Sunshine Coast Minor Hockey Association. You're currently using it for the YMCA of Greater Vancouver, and you use it as a parent. So I think it's safe to call you a bit of an ePACT power user. And for today's session, we're focusing on, obviously, the YMCA of Greater Vancouver and how you've used ePACT to enhance the camp experience for the families that you serve. So I mentioned before that the YMCA supports more than 115,000 people across the Lower Mainland here in BC. And also across 185 locations. So the YMCA provides a variety of programs. We've got aquatic to camps and childcare to youth engagement. And families are actually often registering for more than one throughout the course of the year. So with that in mind, can you share a little bit more about your camps and like the breadth of your programming and the support that you provide to families in the area?
Absolutely. So we have, as you said, 185 branches with a variety of different programming. We have small locations that are more satellite day camps to large 150-acre camps. We have day camps, overnight camps, childcare programs. So we really do serve a breadth of different families. And like you said before, often families who register for maybe an in-city day camp, but then also use our overnight camp program or our childcare.
That's awesome. And so with such a large community to serve, what was the YMCA's process for collecting medical information, waivers, consents, and other important information before moving to use ePACT?
I would say we were sort of across the board, so we had a variety of different ways. Our childcare centers would often collect them in person. Our camps, we would mail them out and hope they bring them on the first day at drop-off time. Sometimes they would mail them in. Our registration is done online or walk-in or by mail. So it was sort of a variety across the board, and nothing was really coming in the same way. We had a variety of different forms that we were using, and nothing was really consistent, and each site needed their own forms to be brought in.
Okay, so definitely a lot of different methods there. So given that much information couldn't necessarily be collected by your registration system, despite it being online, and obviously staff had to rely on collecting information on paper in those various formats, how did that impact your staff from a time management or an administration perspective overall?
Well, I would say in general, our process was very inefficient, and so we were managing them and spending a lot of time managing paper forms and collecting them and where we were putting them and making files for them, and a lot of time tracking down forms that hadn't been handed in and just double checking to make sure that we didn't have it, and having to email people or phone people to follow up. And then half the time they would come in and not be completed properly, or they were filled out early and then things had changed. And it really did take a significant amount of staff time that took time away from them actually spending time with kids or being able to meet the children's needs because there was so much administration.
Right. And kind of a piece that ePACT has done in the past. So some of you may have seen or may be familiar with, we have an infographic or heard about some of the research that we did with that in mind. On average, found that the general administration of forms, so going back to like a lot of the things that you were talking about, so photocopying, distributing, collecting, making copies, following up with families for, as you said, illegible forms or information that was missing, can take 20 minutes or more per form. So if you're managing a large group in any way, that's a lot of time spent, as you said, just on managing those forms instead of focusing on all the other tasks that your team has and spending time with kids. And it's actually a challenge that we hear and address for YMCAs across Canada and the United States all the time. One great example of huge time savings, in addition to the YMCA of Greater Vancouver, is actually the YMCA of Greater Brandywine. They were able to pinpoint exactly how much time they saved using ePACT for their camps last summer. That worked out to a time savings of about 20 hours per week at each of their 8 locations. And so across the breadth of their programming for that summer, they saved almost 1,800 hours, which, I mean, when, that's a lot of time to save, and then, a lot of time that you can then dedicate to other much more important things than managing paper forms. So my next question is, how did you manage families or members individually that required special assistance throughout your programs or camps?
I think that often those can be a little bit more challenging to collect the information, so that then adds to how much time you're spending. We're relying on parents to share the information with us, or having to phone and follow up, or email and follow up, or try and track them down on the first day of camp. And then really we're not as prepared as we want to be to provide a successful camp experience or YMCA experience for those children because we don't have the information in advance. Right.
So again, adding a little bit more to that time, and not too sure about the consistency and the breadth of the information that you're collecting. So once you collected information from families, whether it was going back to anyone with the special assistance requirements, or the general like medical and emergency information, and assuming it is as up to date and accurate as possible by the time camp starts, how did you access that information when it was needed? Whether it was for an emergency of sorts, either a medical emergency or something more widespread, or something as sort of daily as maybe a location or a time change for a particular camp or program?
For us, the information was usually kept in files in our health center, so that because of confidentiality we have to keep them locked up, so we would keep all of that information in one filing cabinet, so that meant making files for each camper. And then staff would have access to what we would call a need-to-know form, so we would put any specific information that was important about a camper on paper, but then they have that, and that can get out, and you have to be careful about privacy with that as well. So also meaning we had to type all that information into another file. And then generally our camp nurses would have access to the information, our camp manager, camp directors. And then trying to have as limited information as we can for the camp leaders so that that's not getting out, but that they can meet the needs of their campers.
Right. So looking at least a handful of different copies and variations, and making sure it gets to those people. Yeah, so definitely seeing challenges with information being accessible to those that would likely need it, so your medical staff or your camp leaders. If they're off-site at any point, I guess they would have had a hard time accessing that critical information, especially if it was not necessarily like in their hands. And I think we can all appreciate the impact that would have on getting support and treatment to a camper in a timely manner when you have to, figure out which form that you should be reaching for and or connecting with the right person.
Definitely.
So actually, going back to the previous comment about assuming information received on those paper forms was up to date and accurate by the time camp started, what happened in the event of information changing? How did families get you new information if it changed after they had submitted their original form?
Well, I guess from the get-go that was a challenge because it was always hard to know if anything had changed, and I think often when they were mailing forms in, they would forget what they wrote on it. So then they would either have to call or email us information or let us know on the first day, and then we're trying to collect that information and quickly write it down. And the first day of camp, those who've experienced it know that it's pretty busy and chaotic as you're collecting campers and luggage and medication, and then you're getting information that you didn't know and writing it on a piece of paper and trying to add it to their file. And so it was really challenging to even know if we had up-to-date information, let alone trying to get that information and adding it to their registration forms or what have you.
Right. So just adding to the fun times of setting up camp and getting ready to go.
Yeah.
Another thing, kind of going back to our research findings, to that point, it turns out that within about 4 months, around 30% of forms fall out of date. So, with camp registration is often either weeks, and in some cases it can be months prior to the camp actually starting. The likelihood then of information changing or being out of date entirely by the time camp starts is actually pretty high. Things like medical conditions, contact details, all those things can change fairly rapidly. So a couple of examples, like a new allergy, or even one that doesn't apply anymore. If a child has maybe outgrown an allergy, or it's not applicable anymore. People move homes, people change phone numbers. So that just goes back to the importance of having a process that makes it easy for families to update their details in real time, so that you're not worrying about that stuff on the first day of camp when you've got so many other things to think about.
Definitely.
So getting more into sort of the ePACT update for YMCA of Greater Vancouver, why did you think that ePACT would be valuable for the YMCA?
Well, funny enough, I stumbled across ePACT as a parent whose child was, my son plays minor hockey, and they started to use ePACT, and I really saw the value of it and how it could cross over to our work with children at the YMCA. Just in allowing families to fill out one form was a huge bonus. So my son was a camper, and being able to connect it and just do it one time for a variety of different programs, not having to send it in each time. Also, I could see the value in allowing our nurses at camp, for example, to quickly sort through information. So for us, for instance, on the first day, we feed them a meal, and getting those forms on the first day and trying to sort through them just to know what a dietary restriction was for a child, so we fed them the right food. Being able to sort them before they get here, and just being able to print that quick information off for our kitchen so that they're not having access to the forms and the other confidential information. Knowing that I have photo releases signed off, medical alerts, all of those things are just so easy to access and just sort. It was amazing.
Well, that's exactly what we like to hear. And so just for the benefit of everyone on our call today, following Lisa's recommendation, the YMCA of Greater Vancouver chose to use ePACT in a pilot project for its spring break camps in 2014. And then and during that time, the ePACT team worked with Lisa and her team to determine the specific needs for like the overnight and the day camp programs. So it allowed ePACT to customize the forms used to collect the necessary information that's applicable to these particular camps and programs and things that these kids are signing up for, and also including the waivers and consents as well. So again, like just continuing on from that last question, how did the overall process for collecting that medical information, your waivers, your consents, or any other key information change with ePACT?
I think that in so many ways we had such a positive impact, from parents feeling more confident in us because we're not madly trying to collect this information while they're dropping their children off. That makes a huge difference for them, and just having that confidence of handing their children over to us for a sleepover camp or a day camp. For us, being able to access critical information ahead of time, and like I said earlier, just having dietary restrictions, having any major allergies or major medical issues that if we aren't aware of, we can do the research ahead of time, so we are prepared to provide a successful experience for those children when they're here. The decreased administration time for our staff was significant on all ends, and really allowed our part-time seasonal staff to be hands-on with children and not trying to chase down medical numbers or those kind of things. Having that single system was way easier. So we have families that will go to a day camp in the city, and then they'll come to our overnight camp, and just having to ask them for one time to fill it out, as opposed to over and over and over because they're coming 8-9 weeks. Just it makes us look that much more professional to our families as well. Being able to access the information anywhere, so if we do have a nurse who's taking a child into the medical clinic, and being able to just access that information and provide it at that time is really, really helpful as well. Having families be able to upload documents and files that relate to their children's medical conditions, and having like a lot of information as opposed to a 1 or 2 liner, because that's all they can fill in the form, has been really helpful as well. And just being able to have that accurate, up-to-date information really helps us to meet the medical needs of the kids that are in our care.
Fantastic. So, I mean, as you know, emergencies are considered emergencies because they're unexpected. So, yeah, we can completely appreciate the importance of collecting that critical information and making sure things are up to date, that they're accurate as well. Again, yeah, you mentioned that it makes you look more professional. It also improves the level of care that, you know, any of your campers might need to receive during their time with you. And kind of one other area to think about too, not necessarily in terms of like a medical emergency, but if for any reason kids need to be picked up from camp, inaccurate contact information for either an alternate guardian if you can't get a hold of parents, or even a parent's phone number, could mean that a child doesn't get picked up quickly or at all, or they're potentially picked up by the wrong person as well. So eliminating those safety and liability implications as well is always a good thing.
Agreed.
So, you know, some feedback from your teams. What have your camp coordinators and administrators liked most about ePACT from their experience with it?
I would say our camp coordinators really like the sort function and how easily accessible the information is, just having it at your fingertips. Being able to just look and see who still needs to send us forms and following up with them so quickly with the even online, just being able to send a reminder, being able to print health forms with children's photos for anyone that has special needs, or for us, people that have no contact, being able to just know who can't be picked up by who. All of that just makes everybody feel more comfortable. I think everyone feels the information is accurate and up to date, and it helps them feel more supported. I think our entire team just loves the system. I can't imagine if we went back to the old system.
Well, I was going to say, now you've gotten used to sort of being a little bit more efficient and focusing on the important stuff. But yeah, I imagine it would be pretty hard to go back to the way things were, as they say. So going back sort of mentioning like with the security and making sure that that information online, how do you ensure that information submitted by families is safe and secure?
Sorry, can you repeat that?
So how do you ensure that the information submitted by families is safe and secure once it's in your possession, or once it's in ePACT, I should say?
Well, I mean, it's having it online is secure. It's not, we don't have all these paper forms wandering around or being left behind, so we can really maintain that confidentiality. We can create groups and assign our leaders to those camps, so only the authorized people who should be seeing them can see them online. We can remove access if a staff leaves or disconnect records, which also really adds that extra safety, and just having that complete control over access to keep information safe and secure. It makes it so much easier because we have all of that control to be able to assign information to people as needed, but also remove it.
Right. Yeah, and security of information stored online, I think, is a valid concern for any organization and also the families that are providing sensitive information like health and medical data. So ensuring you have a way to control access, revoke it quickly if necessary, means that information can be kept private and secure, and that then the right people can access it only in the event of an emergency. So, you know, you're lessening the opportunity for information to be accessed unnecessarily. And again, going back to time savings on, you know, in the case of an emergency, you're not rifling through, you know, binders of paper forms and trying to find the right one, or going through a big filing cabinet of stuff there. And then, you know, a little bit of background piece on ePACT, we make sure that we're compliant. So from a system perspective, we make sure we're compliant with privacy laws in the United States. So with regards to HIPAA, which is and bear with me because it's a long one, Health Information Portability and Accountability Act. And then here in Canada, it's PIPEDA or PIPEDA. I'm seriously not sure how one is supposed to say it, but the Personal Information Protection and Electronic Documents Act. So another long acronym there. And we actually also conduct regular security audits to test our system. So working in conjunction with the efforts of organizations like the YMCA to really maintain that high level of security and ensure that information is safe even though it's stored online. So which areas of the system, areas I should say, of the system do you feel has had the biggest impact on the YMCA of Greater Vancouver?
Well, it's hard to pick one. I would say being able to know who has handed in their forms, like who has submitted them and who hasn't, is a huge time saver for us, and just knowing who we have to follow up with and who we don't. And that really has helped. Also, just being able to sort information and assign that information to the people who need it has also been great. And on top of that, I think that starting with ePACT, we started at Camp Elphinstone in our overnight camps, and then we extended it to our in-city day camps, which are about 8,000 kids, and then, our after-school daycare, and now we're looking at our, our under-5s childcare, and it's making us all look at being more consistent in the information we're asking for, and so that's also been a huge benefit, is just really helping us to become more streamlined and more consistent. So I'd say there's so many things that it's hard to answer that question, but it just overall been such a great process for us.
Perfect. That's what we like to hear. Well, I was going to say my next question would have been about the biggest benefits, but I think you've already covered them. And yeah, as you mentioned, that you've expanded your use of ePACT, and that your team works closely with your ePACT account manager and continually improving your online forms and the user experience. So it's an ongoing process for you guys. Just a couple of questions. I know we're coming close to the half-hour mark, so I actually just have just a couple more questions, and then we'll get into anything that may have come in. What has the feedback been like from the families in your camps, like from the parents or the guardians or even the campers themselves?
I would say just having fewer forms to fill out is a huge bonus. And like I said, we do have crossover for our program, so our families really appreciate only having to do it once. And I think they feel more confident in us as well when we're not saying, oh, we need another one because I don't know where the other one went. The paper form went from week 1 and now it's week 9. So there's more confidence that we're keeping that information confidential. It's so easy for them to update information that it saves them the phone call. They can do it whenever they have time to go online and do it. And so all of those things have really helped our families to really have more confidence in us in the way that we're collecting their information, but also how we're caring for their children.
Fantastic. That's awesome. We love to hear that. So, and this will be my last question. So for any YMCAs considering making a change to their processes around collecting critical information on paper forms, what advice would you give them given your experience with ePACT?
I would definitely recommend a software like ePACT, especially with camp programs or YMCAs that are dealing with large numbers of children or children in different programs or who are using their programs in different ways. It's such an easy way to sort through the information and keep it relevant. It's while also providing access to the right people as opposed to everyone being able to access it or information being left behind or not being well cared for. It also makes it very easy for us as staff. I'd say that it would work for others as well to know you've got the information you need, you have quick access to it. All of those things make it just such an amazing program.
Fantastic. Lisa, thank you so much for chatting with me today and sharing your previous challenges, your ongoing experiences, and also your advice for enhancing the camp experience by not only eliminating paper forms for families, but ensuring that that information is stored safely and securely online.